stand on the opposite shore. Hello, motor. I reach through mysterious ceilings, my only hope. I look for the things I don't know.
All right, DMV. This is Ramona Jones McClain, your insurance guru. I want to say, excuse me for missing last week. Believe it or not, during the time I should have been broadcasting the show, I was sitting on the side of 795 with a flat tire. It took AAA 5 hours to get to me, and I ended up calling Farmers Insurance, and they were with me in little about an hour and 10 minutes. So no show last week, but this week we have our guest, Mr. Jake McGoy, who is with us from a company that's a good friend of ours. That's right up the street, up Ricestown Road, and we're going to be talking about health insurance. We are getting ready to go into open enrollment. So a lot of questions about what's going on with health insurance, what changes have come down the market, and how is that going to affect everybody, especially will health insurance be affected by this impending governmental shutdown? I don't know. We're going to talk about that too. Health insurance is a legal agreement between you and the insurance company or your employer that states that you pay a specific premium for coverage and the insurer pays for at least a portion of your qualified medical expenses. I think that is the issue that is constantly up for debate in every election, whether the insurance company should pay for whatever medical care you need, or do they pay for what is a portion of qualified medical expenses? So, Jake.
Yes.
If you would join me.
Absolutely. Happy to. Thank you for having me.
Yes. So let's talk about health insurance has always been a hot topic since quote unquote Obamacare came along. It's whether or not the biggest issues is how much is going to be covered, and whether or not the coverage I have I can use to see my doctor, whether or not the coverage I have is going to cover my prescriptions. It's just a whole all the way down the list. But let's talk about what health insurance is. What is it supposed to be? What is the overall concept that we as consumers should understand about how health insurance works?
So I think in my opinion, the way that that most people think about it is that it should be what allows them to receive the care they need when they're not feeling well, right? And to put it in the most simple terms, obviously, once you get past that point, it becomes a lot more complicated because there's so many different types that you can get and the costs associated with those. But we have come a long way in this country from where we were 10, 15 years ago. I was selling health insurance plans at that time, and to get into a plan, unless you were joining one through your job, and in that situation you were accepted regardless, just because of the simple fact that you were working in part of that group.
Right.
You would have to undergo or at least pass health questions that were asked and back checked by certain methods that the insurance companies have access to, like the prescriptions that you fill or the doctor's visits that have been billed recently. So they would ask questions about your health and then decide whether or not they wanted to cover you, or decide whether or not they wanted to charge you extra to cover you because of your health, or if they wanted to exclude conditions. So obviously that was a big moment in our history when the quote unquote Obamacare came in, and the Affordable Care Act, as it was deemed by named by Congress.
Yes.
When that law was passed, it did require that there be plans available that would not ask health questions, so that everybody would be able to get insurance, and and that there were certain rules about when could a company charge more, and that they're not allowed to base the premium on your health, other than they could base it, you could be charged a higher rate if you were a tobacco user, or and they did have allow a different scale for males and females, because that they do typically cost a little bit different, and based on age, because obviously a 20-year-old has typically much better health and much less need than a 60-year-old.
Right. Even though I think I have the same needs as a 20-year-old.
Right, in many ways, but yeah, it's the the thing that really is interesting with all of it is that, as an individual, if you have a job, and that company is big enough and in a situation where they have a group health plan, you are offered the option to join that group health plan at whatever terms and conditions the company opts to go with. Right now,
Right.
some companies may want to pay a huge amount of it and make it a big perk and a reason people want to work there. Other companies, especially smaller ones, like I used to own up until a few years ago, would really struggle to provide the health insurance because the cost of it was so high, because of the fact that those people, when they join that group health plan, aren't asked any health questions, and the company
Right.
has to take the new employee. They make the premium astronomically high.
It's a graded policy, so it's already graded on the curve up.
Yeah, exactly.
Mhm.
So a lot of people, kind of gripe about, well, my employer only pays half or whatever. But I mean, it's funny because, right now, with the way that the prices have settled out after the ACA rule has come in, and what you see on the open market, what the insurance really costs, because they have to do the same thing now if it's an
Right.
exchange plan, and the employer plan pricing is like double. so getting it through the employer cost, that the employer and combined, sometimes almost twice what it does on the individual market that's now available. However, there are rules about when you can join in the individual market. You can only join during the enrollment period that's coming up.
Right. Which
Or
is
else,
October 15th.
so that the under 65, the Medicare open enrollment period is October 15th through December 7th. The individual one starts on November 15th, I believe. Maybe it's the first in Maryland. I'll have to look that up real quick. I get them confused, but it's not until November.
Okay.
I always usually worry about the Medicare one first because that starts first. So,
okay.
So anyway, yeah. So go ahead.
So there is a plan on Maryland Healthcare Connection for businesses. I've never looked into it because I think you have to have at least 5 employees to be able to access that. Do you know anything about that?
To have a group plan, typically they say that they need to be 2 or more. Technically makes up a group.
Okay, so it's 2 or more.
2 or more can make up a group, but most of the companies, don't. They want to be at least like 5 is sort of where they start doing pricing, because anything less than that, there's really not, it just doesn't make a lot of sense.
It's not a group, it's just a couple.
Yeah. Right. And sometimes you have a business owner, husband and wife that want to try and do it, and so there's some rules around that. But I mean, typically they can go out and get it individually now, just as easy. That was a big thing before the Affordable Care Act, because many times that would be their only option to get into a plan, was to create a group, and so there's a lot of different plans out there that have come and gone. There's some of the plans that aren't actually insurance, but but utilize group methodologies like
Right.
the different Christian or different religious based plans. Those are
Right.
oftentimes called health sharing plans.
Right. They
Um,
health sharing plans.
yeah, they're actually
I
not
I
insurance.
participated in a couple of those with a few churches that not only did the health insurance, but they also did the life insurance. So they did the group life and they did
Hmm.
the group health. And at one time, I think there was some form of long term care, but they got rid of that because long term care costs are a bit absorbent. And this was back. Let me tell you. Let me tell you when it was. Wait a minute. It was back probably around 2003,
Hmm.
2004, maybe.
Yep, yep.
They don't
There
even
was
do that anymore.
no. There's this stuff is very different now, very very different now than it was at that time. So, um, and that's the other thing that it's like you can't even it's not even something where like people could learn it in school or something and have it just go be with them for the rest of their life because the systems keep changing, right? You
Consistently.
know, it's there's always something new happening. Um, and it really depends on where you live too, because the states have a lot of influence on the what's going on. So here in Maryland, for many years, it's basically been Kaiser and Care First that have been the two options. We had
Right.
United Healthcare had different plans that were available for a while. That before the ACA, before that came into play, and then they went away for a while, and now they're back. They have on exchange plans now available. And this year, which is really exciting in Maryland, we have Aetna coming back with
Right.
on exchange plans. For a little while, we had that nonprofit. What the heck was the name of it?
Aetna Better
Green.
Health.
No. There was another company that was here for just for a minute, like a year or two. It was like uh, green. I want to say green something. Maybe that was their logo was green though. I forget what the heck the name of it was. Um,
Okay.
but anyway, they ended up leaving because it was a nonprofit and they had issues with the Maryland Insurance Administration. But yeah, this year on the individual exchange, we're going to have Aetna, United, Kaiser, and Care First. So we'll be up to four,
Okay.
which is sad to say that that's exciting in some ways, because if you look in some other states, there's 20 options, different
Well,
companies available.
I was interested to know. I always say here in Maryland, if you if you are unemployed and you have children, or even if you don't have children, the Medicaid system here in Maryland is, I think, excellent. There is no
It
reason
is.
why you should not have insurance in Maryland, even if it's outside of open enrollment. If there's an issue, you can go in, you can sign up through the hospital, through a broker, through go to social services. You can get health insurance. I found that interesting in like Virginia. That's not the same thing.
Mm-mm. Yeah, no, very different. Yeah, every state is different. I mean, it's I'm licensed in like 42 states right now. I've only ever done individual health insurance in maybe five or six, but every single one of them is different, and I can't imagine trying to actually do business for the individual health across all of those. For Medicare, I can do it because it all looks very similar from one state to the next. There are some very little nuances, very small nuances, and the pricing can vary from one to the next. But the it's it with under 65 that the whole the Medicaid stuff is all different. There's so many differences in it. It's wild. So I mean, I've had occasion in my career where I've actually said to somebody, you'd honestly be better if you moved to so to here or there, or if they have, sometimes they have, they have family in another state, and they'll say, if
Right. You just need to move to that state.
yeah, if
Right.
you move there for a little while, you'll be in good shape.
Yeah. Well, you got to do what you
It's
got to
sad
do.
though, but it shouldn't. You would think that it wouldn't be like that, but there are situations. But yeah, we do have a great Medicaid system in the state. It's a very generous state with social benefits that way. So that's
But in
helpful.
Virginia, even a disabled person can be disqualified from Medicaid.
Hmm.
if they're bringing in, if they're getting any kind of SSI or anything, where that those are not the rules
Right.
here in
If
Maryland.
if yeah, there's a lot of states where if you become disabled and you end up on Medicare, you don't even get an option to buy a Medicare supplement. The state
Wow.
doesn't require the companies to even offer you anything. They can just say, no, just because you're on disability, we're not even going to ask you health questions. Just the fact that you got Medicare before 65, period, we don't want you. That's it.
Oh
And
wow.
that's a lot of states, actually, believe it or not. I mean, Ohio's like that. Virginia was like that. That changed recently with them. North Carolina's like that. There's a lot of states like that, especially when you get
Wow.
away from the East Coast, where we're at here.
From the
And
metropolitan areas.
yeah, the
You got
New
your
York.
hometown doctors back up in the woods that can come out and set a splint.
Yeah, yeah. Yep, yep. That's
So let's
true.
talk about the different types of health insurance. So we got your HMO,
Hmm.
your health maintenance organizational plan that covers medical expenses typically for in-network visits.
Yes.
If you go out of network, your insurance company may not cover but a portion of the bill or not at all.
Right.
The only exception is emergency care, which is covered in network and out of network.
Yes, exactly. I was just going to say, yeah. So, it's funny. People hear HMO, PPO, and they tend to just say, well, HMOs are bad and PPOs are good, right? Well, but and they don't know what the words stand for. And to be honest, it doesn't really have anything to do. The health maintenance organization, as or preferred provider organization, don't really tell you anything anyway. But in simple terms, an HMO means you're only going to be able to use doctors for regular care that have signed an agreement with that insurance company, and agreed to a schedule of rates for their services. Um, um, your PPO will have those relationships with doctors, but then they also give you an allowance to say, well, you can go anywhere else you want as long as it's for a covered service, and we'll pay. But typically what they do is they pay that doctor whatever they were going to pay the doctor who signed the agreement, and then you end up paying the rest of it anyway. So it gives you some benefit to use wherever they don't have an agreement, but at the same time, they charge you a lot more for it, for the ability to do that. And meanwhile, they don't really spend any more money on the
Right.
care per se. They just have less influence on the doctor and sort of, putting things in place to, cost saving measures or things that they feel will help them, drive the health in the right direction. The the HMO typically is supposed to be more geared towards benefiting the member, the beneficiary, the person who's got the coverage. They have a
Uh-huh.
vested interest in you having less major expenses. And of course, the biggest expense for all insurance companies is hospitals, right?
Right.
That's what
So
really.
they're betting on you doing um the proactive care.
Right. They want you to do take
Right.
preventative measures, get your blood work early, get your immunizations so you don't get sick. See your doctor once a year to make sure that anything that's, caught early if there's a problem, or that they can give you some advice and steer you in the right direction. A lot of them
Okay.
now have even taken to giving you money if you do those things. There's a lot of health plans that actually pay you to go do those things, because
Right.
that's how much they feel it's an indicator of how your long-term health will be.
And they provide transportation
Hmm.
and meal subsidies and
Hmm.
all those things because they want you to be as well for as long as possible.
Yep. It aligns their financial interest with your health,
Right.
which is, I mean, kind of works out, right? I mean, that's a good thing,
Yeah.
for you as the person being covered. So yeah.
Sometimes it's an irritant though.
Yeah. 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 That's true. That is true for
Yeah,
sure. It
well,
definitely can
when my
be.
husband got sick, I guess he was in some version of a HMO,
Uh-huh.
maybe. Not really. I mean, he's on the Medicare, but the way they function was like, first of all, I took him out of the nursing home. Did you know that? I kidnapped him.
Yeah, yeah, I remember you telling me that. Yep.
I kidnapped him and took him home. Literally the next day, Evercore, which is sort of like the management
That's
of preventive care
yep, yep.
for the John Hopkins Advantages program,
Mhm.
was on the phone with me and said, "We were told you took him out of the nursing home. What is his state? Let me send you this." They sent me blood pressure cup, oxygenator, scale. He couldn't even stand up, but I had a scale for him to be weighed to make sure he wasn't retaining fluid.
Yep.
They sent me all of this equipment, and I'm like, wow, oh
Yep.
my goodness. Every Friday morning at 8 a.m., they were calling to find out what his state was.
Mhm.
Did I need anything else? Is the equipment still working? We didn't get the readings from something because what I didn't know in the beginning was that every time I took his vitals, the readings were actually being transmitted to them
Mhm.
through this little tablet that they sent along with it. First of all,
Mhm.
I didn't set the tablet up right. And so the first week they called every day about how the tablet wasn't set up right. And I'm just like, I'm just trying to take care of my husband. Do you have to call every morning at 8 a.m.? Like, oh my gosh, I'm already up all night, every 2 hours, turning him from left to right. Like,
Yeah.
come on. Okay, but I mean, I understood why they were doing it. And in hindsight, like maybe 4 months later, when they insisted that I send the equipment back because he was stable, I was appreciative of the fact that I didn't feel like I was alone.
Right. Yeah, it's
Yeah, I didn't
it
feel like
does
I
it
was
is nice
alone.
when you see that, you know, when you to know that there's some support, because there are a lot of situations where, you know, people have plans and it's just like, well, you know, good
Right.
luck,
You call
you
them
know.
and nobody knows
Yeah.
anything. Nobody
Right.
knows how to get anything. They even assisted, believe it or not, he was at home with a prosthetic, and it took us 6 months to get a wheelchair. I do not understand. First they wanted to put him in a power one, and then they realized he was getting a prosthetic. So you know the insurance company don't want to pay for a wheelchair that's a powered one and a walker or for a prosthetic or something like that. And
Right.
so we had to, and I'm like, he's gonna be walking. Just like, can we just get a regular wheelchair? It took another 4 months for them to switch everything around to get that. But this management company did assist in getting the items to where they needed to go and touching bases. It was irritating though,
Yeah.
because every Friday morning at 8 a.m., I'm thinking it's Friday morning. We don't have physical therapy coming today, or occupational therapy, or speech therapy, or whatever. I can sleep in a little bit, but without
Yep.
fail, they would call about this stupid tablet. I'm sorry.
Yep. No, I hear you. You know, it's funny how, you know, some situations, you know, some illnesses and some things that happen, you know, you will get a lot of attention, and then others you'll get next to nothing. Um, but yeah, I know what you mean. It's on one hand, it's it can be kind of annoying, but um, so yeah, I think that that, you know, those are the two basic types, the PPO and HMO, and then there are, like I said, there are other things. There are plenty of other ways that you can sort of cover yourself with different things, but those are what you
Right.
consider the major medical plans, which are sort of the most thorough options and the most expensive.
I think we
Um,
have a question. Sir, did you have a question about medical insurance? Victor? Victor, are you there? Did you have a question about medical insurance? Let me see. Okay. Um, okay, so the question, why do I have to have health insurance?
Why do you have to have health insurance? Well, you don't have to have it. There was a period of time, a short period of time, where the the rules said that they would eventually institute some sort of a penalty on your taxes annually if you didn't have what they considered credible health insurance.
Right.
Um, that went away. It was revoked as unconstitutional. I mean, the reason for it was to make sure that the only way that insurance companies could sort of swallow that they'd have to take everybody who applied is if
Is if there
everybody
was
applied.
everybody was in the pool, and
Yeah,
that
right.
would create this
Because
big pool of money.
right, but the problem is that a lot of people that were healthy didn't want to buy the insurance and spend the money, and the people that had health issues needed the health insurance. So it ultimately creates the creates a bias that the people that are going to come in and take it are going to be the ones that have a lot of claims. So they're not going to have any
Right.
healthy people. And the whole concept of insurance is that when you take a group of people, that the average will be a certain thing. They'll die at a certain age on average.
Right.
They'll have health situations come up at a certain rate on average. But as soon as you mess around with that by only,
Then you end up having more losses than you have revenue. And
exactly.
I'm trying to explain this to a gentleman who's screaming at me yesterday. It wasn't about health insurance, it was about his business insurance. He's
Hmm.
upset because his business insurance went up $30 a month. And I'm trying to explain to him that health insurance is a pool. And
Right.
he's arguing with me, well, why can't you just take my money, put my money to the side? And when I have a claim, I'm like, because even if we collected your money for 10 years, if you have one huge water claim, there is nowhere in the world we would have collected enough money to cover your claim.
Right.
I
And
mean, I would just have to pay it back later. That's what he said.
yeah, right.
Yeah.
Good luck with that. Well, then you can go on the I'm saving my own money plan, which is and not have insurance. So
But
um,
there
yeah.
are health savings plans, right? But that's not quite how they work, is it?
No, that's a little different. That's a tax break on money that you put aside that you earmark for health insurance, so that the government doesn't tax you on the money that you set aside for that. But if you go use it for something other than that, then you get taxed on it.
Right.
So and penalized. That's just a sort of small business friendly allowance that's made with the laws. It's the IRS laws.
And can you use the money in a HSA? It's HSA, right?
Hmm.
Account to like pay for copays,
Hmm.
pay
Every medical
for
expense
any
stuff.
okay, even equipment.
Yep. Even stuff that's not really covered per se by your health insurance, but that the IRS code says is related to your health.
You mean
So dental.
like chucks or wipes or pull-ups? How about that?
Yep. Yep. That too.
Okay.
Those that would be considered even to some extent stuff you might buy at CVS. Band-aids, gauze wraps,
Okay.
vitamins. You could
Yes.
even stuff like that. So some people are much more into holistic medicine and not so much into Western medicine as we call it, and want to do things more that way. And a lot of that stuff does qualify that way in
Well,
there.
I'm going to tell you, half of my husband's medicine regime, and this is prescribed by doctors, is vitamins, is holistic stuff.
Yeah. I mean,
Um,
it's all very important. If you don't eat right and you don't put the right things in, you're not going to get very good results. So,
exactly, exactly,
um,
exactly.
as who's the guy that did that McDonald's thing? Remember that the guy who did the documentary on eating McDonald's every day for like 6 months or something?
And he
How
had a heart
sick
attack,
he got. I mean, he, gained a ton of weight, got very
right?
sick, got really, really sick. I mean, he was not well. And I don't know how he got away with that without getting sued crazy. But anyway, he, then, and it's funny because then, they did start making some major changes to their menus after that. So,
They did. They also started listing like the calories and
Of everything, yes, very
right.
specifically, and the fat content and all that.
Yes.
Which, yeah, then they were like, oh, I guess we better put some lettuce on the, the sandwich.
Until we had that lettuce situation.
Yeah.
Now they're not even selling salads anymore. That's just
Yeah.
ridiculous. All right, we're gonna take a break for a minute. We'll be right back. Thanks, Jake.
Yep. Thank you.
Hello, DMV. This is Ramona Jones McClain, your insurance guru. I am a farmer's agent located at 11707 Reisterstown Road in Reisterstown, Maryland. Here, you can call me at 443-660-7131 or listen to my show every Thursday at 3 p.m. at podbean.com, The Real Insurance Guru.
As the road you travel changes, so can your insurance need. Talking with Farmers Insurance Agent Ramona Jones McClain can help you assess whether you're ready for the journey ahead. Call Farmers Agent Ramona Jones McClain today at 443-660-7131. That's Ramona Jones McClain at 443-660-7131.
All right, Jake. Let me see what we got
I'm back.
here. Is that the phone number that I should be giving out to everybody?
Yep, that's fine. That's my cell phone. You can text me or call me on that.
All right, so let's talk about the exclusive provider organizations.
Okay. Oh, PPO?
EPO.
EPO. EPOs. EPO would be like a Kaiser.
Okay.
Right?
Right.
I mean, we don't see many.
Probably the John Hopkins network as well.
Yes, they have some plans like that too. So an exclusive provider network would mean that the provider is only working with that network, right? So if you take a Kaiser Permanente, for example, that's sort of a really extreme case, but that is a company that they own the hospital, the doctor's office, everything, employ the doctors, employ the nurses, buy the equipment, and then give you the care. And in some ways, it's great because they have the most vested interest in your health being good, right? Because literally,
and you don't need a referral.
Everything is internal. You go into their office, and they, you need a certain specialist, they'll often just say,
okay,
tell someone, go grab him, or just walk over there, or have them come to you, where you're at. You don't even have to leave the room. They just have the other guy come in.
I think it's like that a little bit at LifeBridge too.
Mm-hmm. Mm-hmm.
You think so?
Yeah. Yeah, it is. Within any system, you do get some of that, and it is nice. I always tell people, like, I use personally the Mercy Health system, Mercy Personal Physicians for the doctors, Mercy and Mercy Hospital is where most of our major stuff would happen. And staying within a system does make a lot of sense because they do share that information internally. They have your records. They can call the other doctor up very easily and say, hey, what about this with this patient of ours?
And that's a big deal when you have somebody like my husband that has multiple medical issues. Getting everybody to talk to one another is just so important. Because you got one person over here doing that or one person over here doing this, and just everybody not being in the loop, and you not being a medical professional trying to communicate something to a doctor that is going on over here, and they're looking at you like, well, you're not the expert.
Right.
They could just go into the chart and look at it and see. You know what I mean? I actually like that a lot. Okay, what is... Oh, this is easy. High deductible health plans.
Right. So your high deductible plan could be any type of network. So the network definitions we were just talking about is sort of how the contracts work with a doctor. The high deductible health plan is a type of plan where you would rather exchange a lower premium for having the first portion of the responsibility be in your hands, or a bigger first portion of the responsibility be in your hands. So, for example, a plan might say, well, we'll charge you, a lot less per month if you are responsible for the first $2,000 of your healthcare bills. Now, you still get the benefit of having the insurance in place in that the bills that you get are going to be at the negotiated rates the insurance company negotiated. And that makes a big difference, right? Because if you just walked into any old ER and you had nothing and you got care, your bill might be $2,000. But if you went in there with insurance and then you look at the bill afterwards and you see what was paid, it was probably $500, right? So, I mean, literally, it's oftentimes 30% of what they have as a retail full price, uninsured price. I don't know why they do that, because I don't know who on earth is going to pay that as much as they say. With some of these things, I mean, a regular specialist visit, is almost $500 now in a lot of cases, just to go see your cardiologist if you didn't have insurance.
We should, when we go to the office and they give us the bill, we should just literally say, "Do we have to pay that?"
Yeah. Who do you charge? Who do you charge that much to? Yeah, I mean, it's kind of wild. So yeah, Is that that's the I don't really like you price? We're not good friends price. What can I get the neighbor price? Oh my goodness. Yeah.
Yes. Can I get the Mr. Rogers price? How about that?
Yeah, exactly.
Mr. Rogers price, the good neighbor. All right. And then when you're trying to choose a health insurance plan, for me, the bottom line is, how much am I gonna have to put out of pocket for the year?
Right.
It doesn't matter if it's a copay or co-insurance or deductible or whatever. Based on everything that I have to do in my medical regime, and it can be quite a bit, especially when you're doing stuff like trying to cut your hand in half. Okay. Like, how much out of pocket? I got this medication, and that was the thing. I text you a couple months ago, and I was like, this prescription plan is not allowing me to pay less for this particular medication. Now, I was just fussing because I could fuss and vent to you, but I knew that it was because it was a new medication on the market, and they haven't really had a chance to classify it. So if something new comes on the market, it automatically goes to tier 3, which is the highest classification. That's right. Tier 3 is the highest. Tier 1
depends on the plan, but tier 1's the lowest.
Right.
Highest can be up to tier 5 in some cases. It depends on how they break it up.
It automatically goes up like to the highest because they don't know the frequency of the use of the drug. They don't have any.
And they don't have any guarantees in place with the manufacturer of, we're going to buy this much from you. That's what it really all comes down to. That's how they negotiate, is they know with, lisinopril, a really common blood pressure medicine, they'll probably pay for 10 million of those tablets. So they can tell the manufacturer, we'll buy 10 million tablets. Oh, well, then we'll sell them to you for 5 cents a piece, right? Versus $5 a piece. So that's where all comes into play.
Right. So, and I understood that, and there are many plans, especially in this state, Maryland, that provide financial assistance. What do you call them when you subsidize medications? There are a lot of different plans that exist. Some of them, a couple you can pay for. Some of them are just income based. That help you with your prescription stuff. And that's what we ended up going to, because it was a new medication, because of my husband's medical history. We ended up getting some assistance from the manufacturer to allow us to be able to get on this medication, because the doctor took samples and gave it to him for 3 months, and the results, his response to just being on it for 3 months was just miraculous. His testing numbers were off the chart, like well better than they could have even anticipated.
Yep.
And so that's like, okay, this is a good response. We need this in our records.
Yeah. Yeah.
Let's keep giving it to this guy.
Yeah. Yeah, no, I mean, it's great when that happens. That's been the same way for my wife with Mounjaro, which is one of these drugs for diabetics that's a once a week injection. And
Right.
she was in terrible shape with even taking 3 different types of insulin and pills to the sugar levels were bouncing up and down all over the place. She'd eat something, it would skyrocket. She'd take the medicine she's supposed to, it would go way too
It would
low.
just drop
And it
down.
was so they call that brittle, brittle diabetic. And because it's, any little thing you do has such an extreme effect that it's very dangerous because, it gets too high or too low, you die. And so
Right.
that was very hard to keep it at a steady, even keel. But she started taking this once a week injection, which was very hard to get approved by the insurance company at first. Took a doctor essentially screaming at them that she was going to die if she didn't get it. And they paid for it, and boom. And within 2-3 months, her numbers were amazing. She was off every other medication. She didn't have to,
Wow.
no more worries about the hospital stays, because she had a couple times that she got taken to the hospital because of it. And all of a sudden the insurance company's like, oh, well, actually, that's not that bad. We haven't had a problem
No, I
since. They
know.
just keep
I
on paying for it. They
know.
got no problem. All of her health has been extraordinary since then,
Right.
in comparison.
Which
So,
ultimately, long term, lowers the cost of her medical costs.
right. Yes, exactly. Yeah. So they're saving money by spending more money on a particular drug.
Just one particular drug. And I don't like to be drug dependent, but the bottom line is there are some situations and conditions exist that where you just have to. You have to be able to do it. You have to be able to get the medication you need. And I think understanding the coverages that are out there,
Mm-hmm.
the coverages that are available, the programs, the plans that are out there, and figuring out like what is the best one that works for you. And this is the time of year, like this is it right here.
Right.
Take your Saturday afternoon, go on and read the plans. Do you want, so for me, I want less copays. I want to pay $2.
Right.
That's it. I just want to pay $2, $1, $2. That's it. I'll pay more premium to pay less copay when I need to go and do whatever I need to do. Number two, for me, I don't want to pay anything for my prescriptions.
Right.
Nothing. Okay, I'm taking 10, 12 prescriptions and randomly they just pull one out and add another one in. I don't want to pay anything.
Right.
I want nothing for my prescriptions. I don't even want to hit the donut. Did we talk about the donut today?
No, that's next week on Medicare.
Okay. I don't even want to go there. Like just and I want to stay out of the hospital and emergency room
Mm-hmm.
for as long as I can. I just switched my doctor to because I live out in Carroll County,
Mm-hmm.
and I was still going to the doctor that I had that was over in Catonsville,
Yeah.
an hour away. Yeah,
That's a lot of
so
drive for.
Finally, and she's fussing at me because she's supposed to see me every 3 months, and I'm like, dude, we can do a virtual appointment. Like I'm not driving out there an hour with Russell in the wheelchair every 3 months.
That's
Just
a lot.
forget it. Just no. So finally, I just went on and switched, and I called 10 different people, and I was looking for the medical professional who I could actually have a conversation with. Because at this point, at my stage in my life, I'm my doctor.
Yep.
If I call you and tell you I have pneumonia, you got to know that I know I have pneumonia.
Mm-hmm.
Okay, I have lupus. I catch pneumonia at least once a year. I know when it's coming. I know when it's starting. I know what's going on with me. Like, you don't even have to question it.
Mm-hmm.
Even my hand. The day I was taking a bit off of a drill. It was an auger bit, the round thing that digs down in the hole. And I was fussing because somebody has moved my hammer drill It's not mine, it's Russell's, but it's mine. And I can't find it. And I'm like, why is everybody coming in here messing with my tubes? So I'm coming in, I'm not paying attention, I'm fussing, I'm tired too. And I went to grab it to remove the bit from the drill, and I could have just left it attached, but it's too many children in and out of my house. And they're kids that will go over and hit the button, and now the drill is flipping all over the living room. But I went over to remove it, and I grabbed it in the wrong place, and the thing went right up in my hand and literally tore, should I say it, the skin off my hand.
Ooh.
I could see my bone.
Oh.
And the whole time, Jake, I'm thinking, okay, can I sew this up myself?
Oh, Lord. Please no. Please
I'm
no.
just like, oh my God, I do not want to go to the emergency room. Oh no. And then I look, I look down, I can see the bone. I was like, okay, this is probably not a good idea for me to try to do this. So it's blood everywhere, okay? I just smashed my hand together, and I'm running upstairs. I go upstairs and wash it out. And I grabbed one of those, those construction cloths that absorb stuff really good.
Uh-huh.
I grabbed one of them because, believe it or not, I live with a retired contractor. We've got 1 million of those around the house.
Yep.
In fact, I use it for all kind of stuff. So I grabbed one from under the sink, and I'm wrapping it around my hand. 2 minutes is soaked with blood. I don't know where all this blood is coming from. I go back to the sink, I rinse it out, and I grab another one and wrap it around. I go in the bedroom. I was like, Russell, I got to go to the hospital. He was like, what? I was like, yeah, I tried to cut my hand in half. I got to go. So I'm not even, mind you, at this point, I can't even feel anything.
Right.
I'm just like, I am in shock, because when I get to the hospital, I park. And when I get out of the car, I realize that there's a cloud around me.
Oh, no.
So I know at this point I've lost way too much blood. And I walk in, and the lady says, okay, what is your name? And everything just goes blank. And I'm just like, okay, I'm just going to give you my my driver's license and my insurance card. It's right here. I'm just going to hand it to you. And she was like, let me get you a wheelchair. I must have been wobbly. I didn't feel wobbly, but I don't really know, because I was in the cloud.
Good grief.
So she sits me down. I'm sitting in the wheelchair. All of a sudden, the cold in the hospital hits me.
Uh-huh.
And this buzzing. And I know it wasn't making sound, but it felt like it was making sound. It's going on in my hand, and it's shooting up my arm. And I'm like, whoa, is this what it feels like at the end? She was like,
oh, man, jeez.
You are not dying. I said, I feel like I'm dying right now. I was like, oh, I must have been in shock. Like, the pain is hitting me, like, right now.
Yep. Oh, man. Wow. Yeah, that's scary.
I called my doctor that Monday, and she already knew. That's how wonderful this doctor is. She had pulled, I guess she had gone in and pulled like the stuff from the weekend, and it had hit my chart because they're all in Carroll County.
Yep.
And she was calling me and said, I need you to come in. I need to see your hand. You didn't try to fix it yourself, did you? I said, no, I didn't. She was like, well, I want you to come in. Let me see it. And that was important to me, finding a doctor who I could communicate to and who I could call and say, look, this is going on with me. I need you to look at this.
Yeah.
This is happening.
Yep.
And who's paying attention.
Yep.
Because I like my husband, I got a lot of specialists all the way around. And I need that general practitioner, to me, should be that person in the middle that's coordinating, that's touching all of these people and saying, hey, I'm seeing this. You need to see her. And that's what she did. I came in, she did bam, bam, boom. I went to see the orthopedic surgeon. And then the orthopedic surgeon sent me to the people who built this.
Mm-hmm.
And they literally did built it, like in the office. They built it, and
Yep,
it's
to
pretty
fit
cool.
you. Yeah. Yep.
But I also have the health insurance that covers that allows me to maintain those relationships and Only pay $2.
There you go. That's good. That's very good.
No, it's more than $2.
Yeah, I was gonna say I haven't seen that plan yet, but that would be pretty impressive. You get $2 for an ER bill. Yeah. But if you had an HSA and you had money set aside, then you could have covered it with that and not been anything extra out of your pocket at the time. So.
Yeah, they asked me, they were like, why did you drive here? Why didn't you call 911 and get an ambulance? I was like, who's paying for that? Okay, no. I got here, didn't it? It's possible I wouldn't have gotten here safe, but I did.
Yeah, the ambulance is no joke. Those bills are no joke. So
no,
they are pricey.
Well, Jake, I want to thank you so much for coming on this week. I hope we answered everybody's questions a little bit about health insurance. We are about to go into open enrollment for everyone. October the 15th for Medicare. We're going to talk about Medicare next week and what you need to know, what you need to get, how you need to handle it, and just any changes that are coming down. And I want to talk about is the government shutdown going to affect Medicare?
No, it will not. All the Medicare stuff is considered essential, so that would stay. That would stay in place, and the bills will still get paid to doctors and such. So Medicare itself doesn't really actually do anything other than act as a payer, right? So there's not like you're going to Medicare to see the doctor. They're just the ones processing the payments and that type of thing. So I don't see that happening. But the Kaiser Permanente strike may impact some people if that happens. That was I just saw that in the news. They're looking at that whole organization was looking at healthcare providers going on strike. So that could be a problem. But we'll keep our eyes peeled on that. What happens? I'll have. Yes. Yep. We can definitely get into that. So, all right. Well, thank you for having me. I appreciate it.
Yes, this is Jake McCoy. If you have any issues about medical insurance or Medicare, definitely give him a call. His number is streaming at the bottom of the screen. If you have any issues or you have questions or any follow-up regarding today's show, you can call me at 443-660-7131. Thank you so much for being with us this week, and we are out.
Hello, Ramona. I can't shake the simplest feeling beyond the ghost. We stand on the opposite shore. Hello, Ramona. I reach through mysterious ceilings, my only hope. I look for